My topic is a trial of treatment for acute othorrea in children with tympanostomy tubes. Tympanostomy tubes, othorrea, also called post-tympanostomy tubes, PTTO, is defined as activated drainage through an existing tympanostomy tubes. Tympanostomy tubes othorrea may occur immediately after tubes insertion from an existing infection in the middle ear, or the later, with quiescent middle ear infection or infectious processes in the ear canal.
When sound waves reach the ear, they are gathered by the funnel-shaped outer ear and channeled into the middle ear. At the opening to the middle ear, sound waves hit the tympanic membrane or eardrum. The resultant vibrations then travel through the middle ear and the fluid-filled inner ear, where they are converted to signals that are sent to the brain. Occasionally, the middle ear can become clogged and infected. Children are especially susceptible to this condition because they have shorter, more narrow eustachian tubes, the tube which allows the middle ear to drain. As fluid and pressure build within the ear, the child may experience pain and hearing impairment. When the infection becomes long-lasting or recur repeatedly, it may be necessary for the child to have a tympanostomy. In this procedure, a small incision is made in the tympanic membrane, and the built-up fluid is drained out. A small tube is then inserted into the incision to allow continuous drainage over a period of a few months. Eventually, the incision begins to heal and the tubes fall out naturally as the hole in the eardrum closes. There are several potential complications associated with this procedure that should be discussed with a doctor prior to surgery.
The prevention: an overview of tympanostomy tube placement and medical care of children with tympanostomy tubes, otitis media with effusion, and treatment and prevention of AOM are presented separately. Tympanostomy tubes othorrea is primarily caused by a bacterial infection. Early onset treatment occurs with 2 weeks of tube placement, while late onset occurs more than 2 weeks after tube placement.
And welcome back once again. This is othorrea, otolaryngologist, head and neck surgeon. In today's short video clip, I would like to demonstrate to you a 17-year-old boy who has undergone 3 times adenylectomy and 3 times insertion of grommets previously. Once the grommets were extruded, once again he developed chronic otitis media with effusion, which caused him conductive hearing loss. After thorough investigation of his nasopharynx using a nasal endoscope, it was clear to me that his eustachian tube openings were abnormal. Therefore, I decided to insert a permanent ventilation tube into his eardrum. The pictures that you are seeing right now is from his eardrum, where I have already performed a myringotomy. Through the myringotomy opening, I am suctioning the mucus collected into his middle ear. Once the middle ear is suction clear from this mucoid material,
Prevention of tympanostomy tubes othorrea. Early onset, approximately 10 to 20% of children who undergo placement of tympanostomy tubes develop othorrea due to bacterial infection during the early postoperative period.
Hi, and welcome back once again. This is Matt, otolaryngologist, head and neck surgeon. In today's short video clip, I would like to demonstrate to you a 17-year-old boy who has undergone 3 times adenosectomy and 3 times insertion of grommets previously. Once the grommets were extruded, once again he developed chronic otitis media with effusion, which caused. Therefore, I decided, once the middle ear is suction clear from this mucoid material, a T-shaped ventilation tube is placed. This T-tube will be permanent, hoping that it will stay there for as long as possible, and allowing the middle ear to get ventilated through this tube, as his eustachian tubes are out of order. Tube is played around and it is inserted. Care must be given not to tear the eardrum, because as you can see the eardrum is not really healthy and it looks calcified. Once the tube is in, practically the job is done. Thank you once again for watching my clips, and stay tuned for future upcoming
There is a lack of consensus among otolaryngologists regarding the need for prophylaxis to prevent early onset tube othorrea, which drugs are most effective and less harmful, and what dosing regimen should be used. Thank you.